You know that feeling, right? That little tickle in your throat turns into a full-blown cough, and your mind just starts racing. Is this the flu? Is it COVID? Could it be something more, like pneumonia? It's so easy to get them all mixed up. So in this explainer, we're going to cut through all that confusion. We'll use the facts to draw some really clear lines and help you understand what actually sets these illnesses apart. Okay, so here's our game plan. First up, we're going to see how these invaders actually get into our bodies in the first place. Then we'll put on our detective hats and decode the symptoms. After that, we'll look at who's most vulnerable, what the modern medical arsenal looks like for fighting back, and we'll wrap it all up with what is, without a doubt, the best strategy of all: prevention. So let's start at the beginning, the invasion. You know, to really get a grip on this fight, you first have to know the battlefield, right? And that battlefield is our own respiratory system. And what's fascinating is that each of these illnesses, well, they're a totally different kind of attacker. And here it is. This is the map of what we're protecting. I mean, look at this. It's the whole journey the air takes, from your nose, down your windpipe, and all the way into these super important tiny little air sacs in your lungs called the alveoli. This right here, this is the territory these microscopic invaders want to take over. Okay, so what's the one big thing they all have in common? It's how they get around. The flu, COVID, pneumonia, they can all hitch a ride on those tiny little droplets that fly out when we cough or sneeze or even just talk. And that's exactly why it's so critical to tell them apart, because they all start their journey the same way.
But once they're inside, this is where their battle plans get really different. Imagine the flu. It's like it sets off a huge, messy, system-wide fire alarm, just inflammation everywhere. Now COVID-19, it's way more subtle. It's like a spy that has a specific key. It looks for these things called ACE2 receptors to unlock a door and sneak right into our cells. And then there's pneumonia, which is just a whole different beast. It's a direct assault, an inflammation of the actual lung tissue, usually kicked off by bacteria or some other bug.
All right, so you've got these completely different attacks happening on the inside, so what does that look like on the outside? Well, our bodies start sending out these distress signals, what we call symptoms. And now we're going to learn how to read them.
Okay, this chart is so helpful for spotting the patterns. Just look at the top three: fever, cough, fatigue. See? Check, check, check for all three. That's where all the confusion comes from. But the devil's in the details, right? Look closer. See how muscle aches for the flu says severe? Or how shortness of breath is rare for flu but a big yes for COVID and pneumonia? These are the little clues that make all the difference.
But there's one clue that's become, well, pretty famous over the last few years. If you wake up one morning and you literally cannot smell your coffee brewing, or your favorite food tastes like cardboard, that is not just some weird minor thing. That sudden loss of smell or taste, it's a huge, distinctive calling card for COVID-19.
Now for pneumonia, there's another really critical warning sign, and this is especially true for older folks. If someone suddenly gets confused or doesn't know where they are, that's not just them being tired. That is a major red flag. It can be a sign the infection is getting really bad and you need to get medical help fast. Okay, so we've got the symptoms down. Now the next big question, who's most at risk? Because, it's not the same for everyone. Now, a lot of the risk factors are similar across the board, things like age and other health issues. But we're going to zoom in and use the flu as our main example here just to see how this whole vulnerability thing really works. And yeah, age is a huge one. Take a look at this. It's the folks at both ends of the spectrum, the very young and older adults who are at the highest risk. And it makes sense, right? At the start of life, your immune system is basically a rookie in training, and later on, it starts to slow down a bit. Either way, it's just not as ready for a big fight. But it's definitely not just about age. Your life circumstances play a massive role too. I mean, think about it. If you're a healthcare worker on the front lines, or you live in a packed place like a dorm, if you're dealing with a chronic illness, or even if you're pregnant, all of these things can ramp up your risk for getting seriously sick from the flu. All right, so we know the invaders, we know the risks. So how do we fight back? Let's take a look inside the modern medical toolbox and see what we've got. And you'll see the strategies are totally different. With the flu, we can actually go on offense. We have targeted antiviral drugs that can help shorten the whole ordeal. But with COVID-19, it's really more of a defensive game. The goal is to manage the symptoms and give the body support, like with oxygen, so it can win the fight. Now, pneumonia, that often requires a full-on counter-assault. The first wave of support is all about getting enough oxygen, pushing fluids, and using meds to open up the airways. But if we know bacteria is the enemy, that's when we bring in the big guns, antibiotics.
They go straight to the source and wipe out the infection.
And when a case gets really serious and someone ends up in the hospital, the care plan is incredibly structured. It's not just random stuff happening. You can see it here for the flu. Every single step has a clear purpose. You've got isolation to stop the spread, you've got oxygen and even positioning the patient in a certain way to make breathing easier. You've got fluids and nutrition to fuel the body's fight, and then of course giving the right meds at exactly the right time.
So we've seen all the ways we can fight back once you're sick. But honestly, here's the most important thing to remember. Our best weapon, our ultimate weapon, is prevention. Because let's face it, the best fight is always the one you don't have to have in the first place. And what's so great is that our best defense is made up of really simple but super powerful habits. I mean, this is the stuff the source material really drills down on. Keeping your hands clean, wiping down surfaces, staying home if you're sick, even just making sure you're drinking enough water and paying attention to your breathing. Every one of those little things adds a layer to our shield.
Just look at this number. 6.3 million. That's the number of global deaths from COVID-19 that our source points to. It's just a staggering, sobering number. And it really brings home what's at stake. It's why every single one of those little preventative actions we just talked about, why they matter so much.
And would you talk about prevention from a medical standpoint? The source material couldn't be clearer. The single most important thing you can do, especially when it comes to the flu, is this: vaccination.
It really is that simple. Vaccination is our shield. That annual flu shot, that's your recommended first line of defense, year after year. And of course, we've all seen just how crucial the COVID-19 vaccines have been in stopping the worst outcomes. They are, without a doubt, a cornerstone of public health.
So, we'll leave you with this final thought. You have the knowledge now. You know how to spot the differences, you understand the risks, and you know the absolute best ways to protect yourself. So the only question left is, what are you going to do with it? What's your next breath and the health of everyone you care about worth to you?